edition of Kendrick's News and Entertainment, and I did a poll that's on the coronavirus, which everyone that comes to this channel can participate. All you would have to do is go to my channel and select the community section, and you will see all of the polls and questionnaires that I asked. And the question was, do you think with the coronavirus being as effective as it is, would you be safer in jails and prisons or out free on the streets living a normal life? And overwhelmingly, 61% said you would be safer on the streets. But there still was like 15 to 16% said you would be safer in the jails. And now we're starting to see the effect of the coronavirus in the jails, because they are officially announcing the numbers that is exploding inside of the United States jails and prisons. And first up the bat is one of the most infamous prisons of all time. You're looking at Rikers Island. The link for this article will be in the description. So according to ABC News, Channel 7, New York City, NYC, the coronavirus update has accurately tested 38 positive people for coronavirus in NYC jails, including Rikers. Now, New York was hit by the nation's largest coronavirus jail outbreak to date this week, with at least 38 people testing positive at the notorious Rikers Island complex and nearby facilities. More than half of them incarcerated men, the board that oversees the city's jail system said Saturday. Now, in a letter to New York's criminal justice leaders, the Board of Corrections said that she learned that 12 Department of Correction employees, 5 Correctional Health Services employees, and 21 people in custody at Rikers and city jails have already tested positive for the coronavirus. Now, at least another 58 were being monitored in the prison's contagious disease and quarantine unit, she said. And I quote, "It is likely these people have been in hundreds of housing areas and common areas over recent weeks and have been in close contact with many other people in custody and staff," said Sherman, warning that cases could skyrocket. The best path forward to protecting the community of people housed and working in the jails is to rapidly decrease the number of people housed and working in them. Now, New York officials have consistently downplayed the number of infections in its prisons and jails. The city's jail agency and its city run-in healthcare provider did not respond to the messages seeking comment on the letter. So on Friday, the DOC said just one inmate had been diagnosed with coronavirus, along with 7 jail staff members. Now, late Saturday, the department acknowledged 19 inmates had tested positive, 2 fewer in the board's letter, and 12 staffs. Now, this is completely not good, people, because if you look at it, the jails and prisons are a shelter. And I quote, Gyron said, "This is like a shelter, so everybody is out and about. They're talking to people, mingling." Last night, a guy was brought in around 6 p.m. A few hours later, 2 police officers came in with masks and gloves on and tried to give the guy a mask. They looked scared. They didn't want to touch him. They told him to pack up, so he packed up, and they took him out. It was crazy. So we have in this country 2.2 million people that is incarcerated in the United States, more than anywhere in the world, and there are growing fears that an outbreak could spread rapidly through a vast network of federal and state prisons, county jails, and detention centers. It's a tightly packed, fluid population that is already grappling with high rates of health problems, and it comes to the elderly and the intern. Elevated risks of serious complications might happen, but limited capacity nationally to test the COVID-19. Men and women inside worry that they are last in line when showing flu-like symptoms, meaning that some may be affected without knowing it.